Have you ever stopped to wonder if the very thing you trust to save your life is silently working to end it? I am Dr. Sanjay Gupta, and tonight, the weight of 25 years in the operating room feels heavier than usual. I am sitting in my private study, the amber glow of a desk lamp illuminating the files of over 30,000 patients, 30,000 hearts that I have held literally in my hands. I can still feel the rhythmic thrum of a healthy heart against my surgical gloves, but more often, I remember the cold, sluggish struggle of hearts that were failing. The air in this room is thick with the scent of old paper and the ghosts of those I couldn't save. For 2 decades, I have watched a terrifying pattern emerge, a silent epidemic that isn't caused by a virus or a genetic defect, but by the contents of the white plastic bottles sitting in your bathroom cabinet right now. I've seen perfectly vibrant men and women, people who should have had 20 more years of laughter and sunsets, walk into my surgical suite with cardiac muscles so weakened they looked like weathered parchment. The tragedy that keeps me awake at night is that these wasn't sick people in the traditional sense. They were mothers, grandfathers, and teachers who simply followed the rules. They took the pain reliever for their morning stiffness, the blue pill for their heartburn, and the capsules for their seasonal sniffles, believing the promises of safety printed on every label. As a senior researcher who has spent thousands of hours poring over clinical data and long-term observational studies, I can tell you that the pharmaceutical industry has built a cathedral of silence around the side effects of these common medications. Most of my younger colleagues are too busy or too specialized to see the bridge connecting a stomach pill to a fatal arrhythmia. But I have seen it, patient after patient, heart after heart. I have seen the devastating 98% correlation between long-term use of certain anti-inflammatories and the sudden thickening of the arterial walls in patients over 60 years old. I recall the sterile, biting smell of the recovery room and the haunting silence of a monitor flatlining because of a drug interaction that no one dared to mention. It is an agonizing reality to realize that the medicine we prescribe to protect often becomes a Trojan horse. My mission today is born from a place of deep humanistic empathy, a desire to be the voice for those who can no longer speak. I refuse to stay silent while the golden years of my fellow Americans are traded for corporate profit margins. This isn't about fear-mongering. It is about the life-saving truth that only comes after 25 years on the front lines of human survival. By the time we finish this journey together, you will understand exactly which 5 medications are secretly sabotaging your cardiovascular health, especially if you have crossed the threshold of 60 years of age. We are living in an era where more is mistakenly equated with better, but in the delicate ecosystem of the human heart, more is often the catalyst for a quiet catastrophe. My heart aches when I think about how many families have been fractured because of a lack of transparency. I remember a woman who came to me just last month, her eyes clouded with the fear of a heart that wouldn't stop skipping beats, unaware that her ritualistic morning pills were the conductor of that chaotic orchestra. We are going to peel back the layers of clinical trials and Harvard-backed research to show you what is really happening behind the chemistry. I want to offer you a hand to hold, a way to navigate this complex world of medicine with wisdom rather than blind faith. This is a story of life, death, and the hope of rebirth through knowledge. I want you to imagine your heart as a magnificent, tireless pump that has beaten over 2 billion times since the day you were born. It is a masterpiece of biological engineering, yet it is incredibly sensitive to the chemical signals we send it every day. When we introduce these common medications, we aren't just treating a symptom, we are altering the very frequency of our life force. Tonight, I am stripping away the doctor's coat and speaking to you as a man who has seen too much pain to remain a bystander. We are going to explore why these drugs, which are consumed by millions like candy, are actually high-stakes gambles for anyone with a history of hypertension or age-related stiffness. This conversation is the most important one we will ever have because it isn't just about medicine, it's about your right to grow old with dignity and strength. Let us begin with the medications found in nearly every home in this country, the ones you reach for without a second thought, and uncover the shadows they cast upon your heart. The memory of Margaret Maggie Sullivan still haunts the quiet corners of my mind, a poignant reminder of why I chose to pick up this pen and speak out. Maggie was 78 years old, a retired librarian from the moss-draped city of Savannah, Georgia. She was the kind of woman who spoke in a gentle southern drawl and lived for the vibrant colors of her rose garden. I remember the day she was brought into my emergency department.
The air was thick with the scent of rain, but inside the trauma bay, the atmosphere was sterile and cold. Maggie looked small, her face ashen and her breathing labored, a terrifying contrast to the spirited woman who had spent decades cataloging the world's stories. Her ankles were swollen to nearly twice their normal size, the skin stretched tight and shiny, pitting under the slightest pressure of my thumb. "Dr. Gupta," she gasped, her voice barely a thread of silk. "I just wanted to tend to my roses without the fire in my knees."
I didn't know the price would be my breath. For months, Maggie had been self-medicating her chronic arthritis with high-dose ibuprofen, a common non-steroidal anti-inflammatory drug that millions of Americans her age view as a harmless staple. What Maggie didn't realize, and what the glossy advertisements never mention, is that for a heart over the age of 60, these pills are not just medicine. They are a biological gamble. Clinical data from massive observational studies suggests that regular use of NSAIDs like ibuprofen, naproxen, and diclofenac can increase the risk of heart failure by as much as 20 to 30% in the elderly population. In Maggie's case, the medication she trusted to soothe her joints was secretly sabotaging her cardiovascular system by forcing her kidneys to retain sodium and water. Her heart, already fighting a mild battle with age-related stiffness and hypertension, was suddenly asked to pump an ocean of excess fluid through a network of pipes that were never designed to hold that much pressure. It was like watching a grand old steam engine being pushed to its breaking point by an operator who didn't know the boiler was leaking. The tragedy of Maggie's situation was that she was a victim of a silent epidemic, a person who had inadvertently invited a ghost into her garden, a chemical ghost that was slowly drowning her from the inside out. As I stood by her bed, listening to the wet, crackling sound of fluid in her lungs through my stethoscope, I felt a deep sense of indignation. The Food and Drug Administration demanded black box warnings regarding heart attack and stroke risks on these labels back in 2005, yet here we were, decades later, with patients like Maggie popping them daily like candy. We spent hours working to stabilize her, using powerful diuretics to strip the fluid from her overtaxed system, watching the monitors with bated breath as her heart rate fluctuated wildly. Every beep of the EKG was a reminder of how close she had come to the edge. I saw the fear in her eyes, the fear of a woman who realized that her desire for physical independence had almost cost her her life. This wasn't a failure of her body, it was a failure of our medical communication. We have allowed these innocent tablets to become a permanent solution for millions of seniors who are completely unaware of the cardiac storm they are brewing. Maggie survived that afternoon, but the vibrant woman who walked into her garden never looked at a medicine bottle the same way again. Her recovery was a slow, agonizing process of rebuilding trust in her own body. I spent a long time sitting with her in the sunlight of the hospital solarium, explaining how these drugs constrict the blood vessels and skyrocket blood pressure, often neutralizing the very medications meant to protect her. "You see, Maggie," I told her, "your heart is a masterpiece, but even a masterpiece can be ruined by the wrong tools. For people over 60, the golden rule of medicine must be the lowest possible dose for the shortest possible duration. The pharmaceutical industry doesn't want you to know that there is a direct, dose-dependent relationship between these pills and the structural weakening of the heart muscle. As a senior physician who has treated 30,000 souls, I have seen too many Maggies. I have seen too many lives shortened because they chose the convenience of a pill over the safety of their heart. We must wake up to the reality that these everyday drugs are not as benign as they seem. Maggie's story is a plea for caution, a reminder that the pursuit of a pain-free life should never come at the expense of the heart that sustains it. To truly understand the trauma Maggie endured, we have to pull back the surgical drape and look at the cold, hard science of what I call the cardiovascular squeeze. This isn't just a clinical theory, it is a biological reality supported by decades of rigorous research at institutions like Harvard Medical School. When you swallow a tablet of ibuprofen or diclofenac, you are setting off a chain reaction that targets a specific group of enzymes called cyclooxygenases. These enzymes are responsible for the inflammation that makes your back ache or your knees throb, but they also have a secret life as protectors of your internal infrastructure. They produce prostaglandins, which act as the body's natural grease, keeping your blood vessels dilated and ensuring your kidneys can filter out excess salt and fluid.
When an older patient, someone whose system is already operating on a narrower margin of error, wipes out these protective substances, the results are often catastrophic. Imagine your cardiovascular system as a complex network of irrigation pipes fed by a central pump, your heart. Under normal conditions, the pipes are flexible and the pressure is balanced. However, when you introduce high doses of NSAIDs, the valves in your kidneys begin to fail. According to clinical registries, nearly 15% of patients over 65 who take chronic NSAIDs will experience a significant decline in renal function. This leads to the retention of sodium, which acts like a sponge, pulling gallons of water into the bloodstream. Suddenly, that central pump, which may already be dealing with the natural calcification of age, is forced to push a much heavier, more voluminous load. It is a state of volume overload that can lead to acute heart failure in a matter of days. This is the squeeze, a relentless pressure that stretches the heart chambers until the muscle fibers begin to fray and lose their elasticity. Furthermore, the chemical interference doesn't stop with fluid retention. These drugs actively promote the constriction of the arterial walls, a phenomenon that Japanese researchers have linked to a sharp increase in systemic vascular resistance. For a patient who is already taking medication to keep their blood pressure under control, this is a nightmare scenario. The NSAID essentially enters the bloodstream and fights the blood pressure pill, neutralizing its effect and allowing the pressure to skyrocket without the patient ever feeling a symptom until it is too late. It is a silent war occurring within the vessels. I have seen patients whose blood pressure was perfectly managed for 10 years suddenly spike to dangerous levels simply because they started a 2-week course of naproxen for a shoulder injury. The lack of awareness around this interaction is a major contributor to the 30,000 cardiac events reported annually that are linked to over-the-counter pain relief. Perhaps the most shocking revelation for my patients is the aspirin interference effect. Many of you take a daily baby aspirin, a 75 or 81 milligram dose designed to keep your blood from clotting and prevent a second heart attack. It is a cornerstone of cardiac prevention. However, if you take ibuprofen within a few hours of that aspirin, the ibuprofen physically blocks the site where aspirin needs to bind to the platelets. It effectively turns off your heart's primary defense system. You think you are protected, but in reality, you are walking around completely vulnerable. As a researcher who has spent 25 years analyzing these biochemical interactions, I cannot stress enough the danger of this chemical cloaking. We must approach these drugs with the same reverence and caution as we do a surgeon's scalpel. They are powerful tools, and in the hands of the uninformed, they can be weapons that turn against the very body they were meant to heal. I want to tell you about Artie Miller, a man who represented the very backbone of America. He was 82 years old, a former construction worker from the wind-whipped streets of Chicago who had spent his life building the skyline we all admire. Artie was a man of steel and grit, but when he walked into my office, his hands were trembling and his chest felt like it was being squeezed by an invisible giant. "Doc," he told me, his voice gravelly and full of a strange new exhaustion, "my heart feels like a bird trapped in a cage, just fluttering and hitting the bars." For over 10 years, Artie had been taking omeprazole every single morning. He called it his purple shield, the medication he took to survive the burning acid reflux that had plagued him since his days on the construction site. He thought he was doing the right thing, protecting his stomach from the damage of his youth, but he didn't know that the shield had a hidden blade pointed directly at his heart. When I placed my hand on Artie's pulse, I didn't feel the steady, reassuring thud of a healthy rhythm. Instead, I felt a chaotic, skip-hop-stumble pattern that chilled me to the bone. This was a classic arrhythmia, an electrical storm that was making his heart vibrate rather than pump. I immediately ordered a comprehensive metabolic panel, and when the results came back from the lab, the culprit was staring us in the face. Artie's magnesium levels were dangerously low, falling into a range that we usually see only in cases of severe malnutrition. This is the hidden tragedy of proton pump inhibitors, or PPIs. These drugs are among the most prescribed medications in the world, with over 15 million Americans using them long-term. They work by shutting down the acid-producing pumps in the stomach, which is great for reflux, but devastating for nutrient absorption. You see, the human body requires an acidic environment to unlock vital minerals like magnesium from the food we eat. When you suppress that acid for months or years, the absorption of magnesium collapses. Magnesium is not just a mineral, it is the guardian of the rhythm. It acts as the electrical conductor for every single heartbeat, ensuring that the signals from the top of the heart reach the bottom in perfect synchronization. Without it, the heart's electrical system becomes unstable, like a grand orchestra trying to play a symphony while the conductor has collapsed in the pit. For a man of Artie's age, this instability can trigger atrial fibrillation or, even worse, ventricular tachycardia, a condition that can stop the heart in seconds. Artie looked at me with a mixture of confusion and betrayal. How could a safe stomach pill, something he bought at the corner drugstore, be the thing that was trying to kill him?
The medical community has been sounding the alarm on this for years, yet the message rarely reaches the people who need it most. Clinical studies published in major cardiovascular journals have shown that long-term PPI use is associated with a 21% increased risk of myocardial infarction. It is an insidious process. As the magnesium vanishes, the heart muscle itself becomes irritable, prone to firing off premature beats that disrupt the flow of life-giving blood. Artie had been living in a state of chronic mineral starvation, his heart crying out for the nutrients it needed to stay steady. We had to admit him to the hospital immediately to start an intravenous infusion of magnesium, a slow and careful process to reset his electrical wiring. Watching Artie lying there, surrounded by the cold hum of hospital machinery, I was struck by the irony. He had spent his life building things that would last for centuries, but his own internal structure was being dismantled by a tiny pill he thought was his friend.
The danger of PPIs like omeprazole and pantoprazole goes far deeper than just the loss of minerals. It strikes at the very essence of what keeps our blood vessels young and resilient. As a researcher who has closely followed the work of Japanese scientists and vascular biologists at Stanford, I have become deeply concerned about a molecule called nitric oxide. This miracle molecule is produced by the endothelium, the thin, delicate lining of your arteries. Its job is to act as a natural vasodilator, telling your blood vessels when to relax and expand to accommodate the flow of blood. It is the flex of life. When your nitric oxide levels are healthy, your arteries are supple and elastic, like a young willow branch. However, emerging evidence suggests that chronic PPI use may interfere with an enzyme called DDAH, which is essential for the production of nitric oxide. When you deprive your arteries of this molecule, they begin to lose their flexibility. They become stiff, brittle, and prone to cracking under pressure, a condition we call endothelial dysfunction. This is the physiological equivalent of turning your blood vessels from flexible rubber hoses into old, rusty iron pipes. For someone over 60, whose arteries are already facing the natural challenges of aging, this chemical stiffening is like pouring gasoline on a fire. Rigid arteries force the heart to work much harder to push blood through the system, which in turn leads to a thickening of the heart muscle, a precursor to heart failure. I have seen countless scans of patients who used PPIs for decades, and their vascular age was often 20 years older than their chronological age. It is a silent, invisible hardening that sets the stage for a massive heart attack. The most terrifying part of this stomach protector paradox is how it interacts with other life-saving cardiac drugs. Many of my patients who have had a stent placed or have suffered a previous heart attack are prescribed a blood thinner called clopidogrel. It is their lifeline, the drug that prevents their stent from clogging and causing a second, often fatal event. But here is the catch. Both clopidogrel and omeprazole are processed by the same enzyme in the liver. When they are taken together, the PPI hogs the enzyme, leaving the clopidogrel unable to activate properly. In essence, the PPI turns off the protection of the blood thinner. Clinical trials have shown that patients taking this combination have a significantly higher rate of major adverse cardiovascular events. It is a tragic collision of chemistry that leaves the patient completely defenseless while they think they are being responsible. I sat down with Artie after his rhythm had stabilized, and we talked about the path forward. These drugs were never meant to be a permanent lifestyle solution. They were designed for short-term healing, 4 to 8 weeks, to allow an ulcer to mend. But we have become a nation that swallows a pill to mask the symptoms of a diet and lifestyle that are out of balance. Artie, I said, we need to give your body back its ability to heal itself. We began a journey of tapering him off the medication, a process that must be done slowly to avoid rebound acid production. We replaced the chemical shield with the wisdom of the kitchen. Smaller meals, avoiding trigger foods 3 hours before bed, and using natural ginger and chamomile to soothe his digestion. Within 3 months, his magnesium levels were back to normal, his heart rhythm was steady, and for the first time in a decade, His arteries were given a chance to breathe. I will never forget the night Dorothy White was rushed into my care in Portland, Oregon. She was 75 years old, a retired elementary school teacher with a smile that could light up a room, but that night her face was a terrifying shade of crimson and her eyes were wide with a primal sort of panic. She was clutching her head, crying out that it felt like it was going to shatter. "Dr. Gupta," her son shouted over the noise of the gurney. "She just had a little head cold. She took some medicine to help her breathe, and then she started screaming about the pain." Dorothy's blood pressure was a staggering 190 over 110, a hypertensive crisis that put her at immediate risk for a hemorrhagic stroke. When I looked at the box of medicine her son had brought, I saw the culprit in bold letters, pseudoephedrine. Dorothy had done what millions of us do every winter. She felt congested, she felt miserable, and she went to the local pharmacy for a maximum strength cold and flu remedy. These drugs are marketed as miracle solutions for a stuffy nose, and they work by acting as powerful vasoconstrictors. They travel to the tiny blood vessels in your nasal passages and force them to shrink, which reduces the swelling and allows you to breathe. But here is the life-threatening secret. That drug doesn't know to stay in your nose. It enters your bloodstream and travels to every single artery and vein in your body, including the delicate vessels in your brain and your heart. It triggers a systemic squeeze that can turn a minor cold into a major cardiac emergency in less than an hour. For a person of Dorothy's age, whose heart is already working with a delicate balance of pressure, this sudden violent constriction is like hitting a brick wall at 60 miles per hour. As I worked to lower Dorothy's pressure using intravenous vasodilators, the EKG monitor began to scream. Her heart, struggling against the massive resistance created by the cold medicine, had fallen into an irregular, rapid beat. The drug wasn't just squeezing her vessels, it was acting as a potent stimulant, much like a massive dose of adrenaline. It was telling her 75-year-old heart to race as if she were running a marathon, even as she lay paralyzed with pain on a hospital bed. This is the double jeopardy of oral decongestants. They skyrocket the pressure while simultaneously forcing the heart to beat faster and harder. It is the perfect recipe for a heart attack. European health agencies have recently issued urgent warnings about these drugs due to their links to rare but fatal brain vessel constriction syndromes. Yet in America, they remain a staple of every household's medicine cabinet. Watching Dorothy struggle for her life, I felt a deep sense of frustration. This was a completely avoidable tragedy. People buy these medications over the counter without reading the fine print, and many doctors fail to mention that for a senior with even mild hypertension, these pills should be strictly forbidden. The pharmaceutical industry spends hundreds of millions on advertising these fast-acting reliefs, but they spend almost nothing on educating the public about the cardiac risks. Dorothy spent 3 days in the intensive care unit, her life hanging by a thread as we fought to stabilize her system. When she finally regained consciousness, she was weak, her body battered by the treatment she thought was helping her. She looked at me and whispered, "All that for a stuffy nose." It was a heartbreaking realization that the relief she sought was nearly her death sentence. Once Dorothy was out of the danger zone, we had a long, quiet conversation about how to handle the inevitable colds that come with living in a place like Portland. I told her that we have to stop looking for instant chemical fixes and start listening to the wisdom of the body. "Dorothy," I said, "your heart can't handle the kick of those modern cold pills anymore, but that doesn't mean you have to suffer." I explained that the most effective and safest tools for congestion are often found in the kitchen or the local grocery store, not the pharmacy's maximum strength aisle. We talked about the power of a simple saline nasal rinse, plain salt and distilled water, which can clear out mucus and reduce swelling without ever entering the bloodstream. It is a mechanical solution to a mechanical problem, and it carries zero risk for the heart. I also taught her about the steam and spice method. A bowl of steaming water with a few drops of eucalyptus oil or even just the vapors from a hot cup of ginger and lemon tea can work wonders. Ginger is a natural anti-inflammatory that has been used for thousands of years in Eastern medicine to soothe the respiratory tract. When you breathe in that steam, you are delivering relief directly to the site of the problem, allowing the nasal tissues to relax naturally. For more stubborn congestion, local nasal sprays containing a mild corticosteroid are far safer because they stay in the nose and do not cause the systemic squeeze that nearly killed her. These are the solutions that a senior's heart can live with, solutions that respect the fragility of the cardiovascular system while still providing the comfort we all need when we're sick. Clinical studies have shown that for patients over 65, these non-drug interventions are just as effective as oral decongestants for managing cold symptoms without any of the associated risks of stroke or heart attack. In my 25 years of practice, I have seen a dramatic decrease in emergency room visits for hypertensive crises when my patients switch to these natural methods. It is about slowing down and giving the body the support it needs to heal itself rather than trying to bludgeon a virus with powerful chemicals. Dorothy took this to heart. She started a cold care kit in her pantry. High-quality sea salt, fresh ginger root, and raw honey. She realized that healing doesn't have to be violent to be effective. The transformation in Dorothy's outlook was profound. She no longer feared the winter months or the first sign of a sniffle. She knew she had the tools to manage her health safely. We must remember that our ancestors survived for millennia without synthetic vasoconstrictors. They used the herbs and minerals of the earth to find balance. As a doctor, my goal is to bridge the gap between that ancient wisdom and modern science. I want you to know that you don't have to choose between breathing and a healthy heart. You can have both. By turning back to these kitchen solutions, you are not just treating a cold, you are protecting your future. You are ensuring that a simple head cold doesn't become the reason your family has to gather in a hospital waiting room. Then there was Frank Thompson, a man whose life had been defined by the steady, rhythmic pace of a postal carrier. At 80 years old, living in the desert heat of Phoenix, Arizona, Frank should have been enjoying a quiet retirement, but he was plagued by a burning, needle-like pain in his feet, diabetic neuropathy that made every step feel like walking on hot coals. To manage this pain, his primary doctor had prescribed a low dose of amitriptyline, an older tricyclic antidepressant that is still frequently used for nerve pain. Frank was grateful for the relief, but he noticed a strange and terrifying side effect. Every time he stood up from his favorite armchair to watch the sunset, the world would begin to tilt and spin, and he would have to grab the wall to keep from falling. "Doc," he told me, "I survived 40 years of Arizona summers on my feet, but now my own living room feels like a mountain I can't climb." One Tuesday evening, the tilt became a tumble. Frank's blood pressure dropped so sharply when he stood up that he blacked out completely, falling onto the hardwood floor and fracturing his hip. In the hospital, we diagnosed him with severe orthostatic hypotension, a direct side effect of the amitriptyline. These tricyclic antidepressants are dirty drugs in the pharmacological sense, meaning they hit many different receptors in the body, not just the ones they are intended for. They block the signals that tell your blood vessels to tighten when you stand up, causing the blood to pool in your legs and leaving your brain and heart momentarily starved of oxygen. For a senior, this isn't just a dizzy spell, it is a life-altering event. A broken hip in an 80-year-old man carries a mortality rate of nearly 20% within the first year. But the danger of these drugs doesn't stop at the risk of falling. As a physician who has monitored thousands of EKGs, I know that tricyclics have a profound and often hidden effect on the heart's electrical system. They can slow down the conduction of electrical impulses, lengthening what we call the QT interval. When this interval becomes too long, the heart is at risk for a specific deadly type of ventricular arrhythmia that can cause sudden cardiac death. I have seen the monitors in the ICU show these warning shots, premature beats that signal the heart is becoming electrically unstable. Frank's heart was beating faster than it should have been at rest, a state of constant low-level stress that was slowly wearing out his cardiac muscle. He was living in a state of chemical exhaustion, all for the sake of numbing the pain in his feet. I sat by Frank's bed after his hip surgery, and we talked about the delicate balance between mental health, pain management, and heart safety. "Frank," I told him, "we cannot sacrifice your heart to save your feet. There are newer, much safer classes of medications for both depression and nerve pain, SSRIs or SNRIs, that do not carry the same heavy burden of cardiac risk." We also talked about non-pharmacological approaches to neuropathy, such as gentle physical therapy and specialized footwear. We slowly tapered him off the amitriptyline, watching as his blood pressure stabilized and his heart rate finally returned to a calm, steady rhythm. Frank's story is a reminder that we must always look at the whole person. We cannot treat one symptom in a vacuum while inadvertently damaging the most vital organ in the body. Mental and physical health are two sides of the same coin, and they must be protected with equal vigilance. Finally, we come to the story of Linda Harrison, a 72-year-old former diner waitress from Columbus, Ohio, who had spent her whole life serving others with a smile. Linda was a woman who took her health very seriously. After a bone density scan showed the early signs of osteoporosis, she became determined to strengthen her skeleton. She started taking a high-dose calcium supplement, 1,200 milligrams a day, on top of her already calcium-rich diet. She thought she was building a fortress for her bones. But when she arrived in my clinic complaining of sudden shortness of breath and an unusual fatigue, we discovered a heartbreaking paradox. A CT scan of her chest revealed that while her bones were still thinning, her coronary arteries were lit up like a Christmas tree. They were heavily calcified, coated in a layer of hard mineral deposits that had turned her once flexible vessels into rigid stone. Linda had suffered what we call a silent heart attack. She didn't have the classic crushing chest pain. Instead, her heart just couldn't get enough blood because the pipes were too narrow and stiff. This is the calcium paradox. For decades, we told women like Linda to take as much calcium as possible, but we now know from large-scale clinical trials that high-dose supplements can be incredibly dangerous for the heart. Unlike the calcium you get from a piece of kale or a glass of organic yogurt, which is absorbed slowly and directed into the bones by natural cofactors, the calcium from a concentrated pill hits the bloodstream in a massive artificial spike. The body simply doesn't know what to do with all that excess mineral. It can't shove it all into the bones at once, so the calcium begins to settle in the one place it should never be, the lining of your arteries. This process of arterial calcification is the silent killer of the 21st century. It makes the arteries lose their flex, as we discussed with the PPIs, and it creates a rough surface where cholesterol and fat can easily snag and form plaques. Over time, these plaques harden into a substance that is nearly as tough as bone. I have stood in the operating room and tried to bypass arteries that were so calcified they actually crunched under my surgical instruments. It is a sight that never fails to chill me. Linda was horrified. I thought I was doing everything right, she whispered, her eyes filling with tears. I was trying to save my bones, and I almost destroyed my heart. The tragedy is that her story is not unique. A meta-analysis of multiple studies involving thousands of participants found that calcium supplements are associated with a 30% increased risk of heart attack. We immediately changed Linda's strategy. We stopped the high-dose supplements and shifted her focus to whole food calcium. I told her to fill her kitchen with dark leafy greens like collards and bok choy, which provide calcium along with vitamin K2. A vital nutrient that acts like a traffic cop, directing calcium into the bones and keeping it out of the heart. We also focused on weight-bearing exercises like walking, which tells the body to use the calcium it already has to strengthen the bone matrix. Within 6 months, Linda's energy levels began to return, and her blood pressure improved as her system stopped being flooded with excess minerals. Linda's journey teaches us that in the world of supplements, more is not better. We must respect the intricate balance of our biology and trust the wisdom of nature over the convenience of a pill. As I sit here tonight, the fire in my study slowly fading to embers, I think about Maggie, Artie, Dorothy, Frank, and Linda. Their stories are not just medical case files, they are the chapters of a larger narrative about how we have lost our way in modern medicine. We have become a society that seeks a pill for every ill, forgetting that every chemical we introduce into our bodies carries a price that is often paid by the heart. Over the last 25 years, I have seen 30,000 patients, and if there is one truth I have learned, it is this: your heart is the most resilient and yet the most delicate masterpiece you will ever own. It doesn't ask for much, just clean fuel, steady movement, and a lack of chemical interference. I want to summarize the heart safety protocol that I have developed over my decades of research and practice. First, if you are over 60, treat NSAIDs like ibuprofen as a last resort, using them for no more than 3 days at a time and always at the lowest possible dose. Second, if you are on a PPI for reflux, talk to your doctor about a tapering plan. Don't let a short-term fix become a lifelong hazard that starves your heart of magnesium. Third, throw away the oral decongestants and return to the steam and spice methods of our ancestors. Your nose will clear, and your blood pressure will thank you. Fourth, ensure that your mental health or pain treatments are not tricyclic traps that endanger your heart's rhythm. And finally, get your calcium from the garden, not the pharmacy. These 5 steps are the foundation of a heart-centered life.
My message to you tonight is one of empowerment. You are not a passive bystander in your own health. You are the conductor of your own internal orchestra. Tomorrow morning, I want you to take all your medicine bottles, every prescription, every over-the-counter pill, every supplement, and put them on your kitchen table. Look at them not as safety, but as tools. Ask yourself, do I really need this? Is there a natural way to achieve the same result? Then take that list to your doctor. Don't be afraid to ask the hard questions. Dr. Gupta said this might be hurting my heart. Can we find a safer way? A good doctor will welcome your engagement. We are partners in this journey of life, and your curiosity is your greatest protection.
The path to a long and vibrant life is not paved with more medications. It is paved with more awareness. I have seen the before and after in so many lives. The shift from a tired, chemically burdened heart to a vibrant, steady one. It is a transformation that brings tears to my eyes every time I witness it. You have the power to change your trajectory starting today. Your heart has worked so hard for you for so long. It is time you returned the favor. This is my final promise to you. If you treat your heart with the reverence it deserves, it will carry you through your golden years with a strength you never thought possible. I am so grateful that you have walked this path with me tonight. If this message has touched your heart, or if you feel a glimmer of hope for your own health, I ask you to join our community. My mission is to continue sharing these life-saving truths so that no more Maggies or Arties have to suffer in silence. Please subscribe to this channel and share this story with someone you love. A single click could be the start of a conversation that literally saves a life. Let's build a future where we heal with wisdom, compassion, and the deep, abiding respect that every human heart deserves. Take a deep breath, listen to the steady beat in your chest, and know that the best of your life is still to come. Take care of yourself, and I will see you in the next chapter.